So hi everyone, this is Tim Mackey. I'm the moderator for this poster session. Looks like people are coming in from the rapid fires. We're going to get started in just about a minute and we'll get through all the posters and make sure everyone has the opportunity to present. And apologies for people in the yesterday's session that weren't able to present. There's some really great posters there, but unfortunately we just ran out of time. So again, looking forward to having you guys present. If you can, as a quick reminder, because we do want to get through all the posters and hopefully we'll have some time at the end and people can ask questions more specifically for each poster. Just have your basic research question and a brief summary of your primary findings. And then we'll see if we can take one question per poster at the end of each poster, and then we'll move on. And I'll be monitoring the chat, but we will see if you have a question, go ahead and just unmute your line and ask it so that we can get through the questions pretty quickly.
Great.
Sarah, what do you think? Ready?
Let's get started. I just heard from the group that they wrapped up the rapid fire presentations.
Great, sounds good. So the first poster we have here is titled "A Content Analysis of Non-Medical Cannabis Companies' Social Media Marketing Strategies in the District of Columbia." If you're the author or the presenter, can you just unmute your line and go ahead and get us started?
Hey everyone, can you hear me?
Yes, we can hear you good.
Awesome. So thanks for the introduction. My name is Nithin Charlie. I'm a third-year medical student at University of Wisconsin-Madison, and I'm in Dr. Megan Moreno's lab in the Department of Pediatrics here. So, and we kind of look at, the entire lab kind of looks at the intersection of three things, mainly technology, adolescent medicine, and health. So how my project kind of fit into that was I basically investigated how non-medical cannabis or recreational cannabis is being advertised on social media, and specifically on Instagram and in the area of Washington, D.C. I had a couple of interesting findings, but some things I wanted to highlight was that youth appeal was pretty common. The prevalence of youth appeal was pretty common among non-medical retailers. And throughout my process of investigating and looking more into this, I found that two new promotional techniques were used called diversity marketing and pro-cannabis education.
Sounds very good. Any questions from the audience? I have a few thoughts, but so if no one asks a question, I'll probably ask a question, but we'd rather have other people ask questions. Anyone with a question, go ahead and unmute your line and you can ask it directly. All right, I'm going to ask a quick question, but if you do have a question, we can do it at the end. You looked at youth marketing. That's really fascinating. In the context of non-medical cannabis, that's illegal, correct? To market to the youth. So what type of marketing did you feel was the most egregious or something that may need to be acted upon from a policy perspective? Yeah,
so that's a really good point. So in most states where it's where recreational cannabis is legalized, they do have rules against that in terms of online marketing. But in the District of Columbia, it's pretty unique where they have rules for advertising medical marijuana, but not recreational marijuana. So because of that fact, I guess I wasn't too surprised at the high prevalence that I found. Some of the interesting stuff I found, you can kind of see at the bottom in the middle section of my poster. Something that was really common was using stuff that kids would interact with, like you can kind of see a picture of SpongeBob hitting a bong there and looking obviously intoxicated, and below that you can see the famous candy Tootsie Pops, but they kind of switched that up with some sort of marijuana joint.
Wow, that's could be some great image-based analysis you could do there. Thanks so much. We're gonna keep going, and again, I hope we have time to go back through these posters, but we just want to make sure we get everyone to be able to present. So the next, thank you very much, by the way. The next presentation is COVID-19 on TikTok. This is one of the few TikTok studies I think we've had through this conference, which will be great. harnessing an emerging social media platform to convey important public health messages. If you're an author, go ahead and unmute and go ahead and present.
Hi, how are you? Christy Jaime. I work alongside with Dr. Bosch as the lead. She's the lead on this TikTok. We work for William Patterson University at the Department of Public Health. The purpose of this was a cross-sectional study to describe the content of COVID-19 on TikTok, really popular social media platform. So the posts included in the study were viewed over 1 billion times. Most commonly cited topics included anxiety and quarantine, and fewer than 10% of the videos mentioned how actually the virus was transmitted, or symptoms, or matters of prevention. We did see that, TikTok has this huge potential to not only convey important health information, but to also address these aspects of COVID over the pandemic. So we did see it as an opportunity lost for that, because of the platform, because of the amount of users and the age bracket that TikTok has, the potential that it has there. So it was one of our findings for that.
Great, sounds good. Any questions from any of the participants? And again, go ahead and unmute your line and just ask it directly, and we'll filter through whoever needs to ask a question if we have multiple questions. Okay, I'm gonna ask a quick question. It looks like you were doing mostly, oh, sorry, go ahead. Please go ahead.
Oh, sorry. I was just wondering if you found any themes of humor, or like what the sentiment was of the videos, whether most were kind of comical or serious.
Dr. Bosch, I mean, we weren't necessarily looking for that, but as TikTok is, it's a quick snippet of like a couple seconds of videos. A lot of it was, you did find things that were humor related, and things that, were titled COVID, were not necessarily based on COVID. And the many things that we did see were just, their reactions to things like the anxiety about it, but it wasn't, that's pretty much all we saw, which was funny.
And I'll just jump in and say, we also compared these. We analyzed all of the posts that the World Health Organization made on TikTok, because they did start an account during this time to address COVID issues. And those were obviously a lot more serious than just the regular consumer posts that we compared them with. But we did think it was super interesting that we know the audience is a very young audience, and they were expressing a lot of anxiety about being in quarantine. And given that mental health issues, we feel, are going to continue to emerge from lockdowns and teens being at home, this was serving as a real outlet for this population to be laughing and dancing and showing what they're doing in quarantine, and just venting about that.
Yeah, I think there's a lot of interesting areas in methodology around TikTok, because it's so hard to classify posts. So thank you very much again. We're going to go on to the next one, but that was a great presentation. I'm really curious about that research.
Thanks.
The next one is machine learning analysis for the characterization of vape, e-cigarette marketing and sales on Instagram. Neil, if you're there, go ahead and present.
Hey, can everyone hear me? I'm using this microphone for the first time.
Yeah, you sound good.
Okay, cool. So my name's Neil Shaw. I work at the lab of our current moderator at UCSD. So this study is machine learning analysis for the characterization of vape e-cig marketing on Instagram. So social media, and Instagram in particular, it still kind of remains a marketplace for the trading of potentially like unregulated and illicit goods, including unregulated vaping products that can cause harm to people. So we found that Facebook and Instagram kind of have a vague policy when it comes to what advertising / sales of unregulated vaping products by unregulated sellers are allowed online. So in order to kind of understand the sphere that was happening, we used a machine learning methodology to kind of categorize vaping sales on Instagram. And I guess some of the main results that we found is that about 50% of posts related to the advertising / sales of vaping products came from unverified online and individual sellers that were not associated with an established brick and mortar store. And we found that they were mainly selling and advertising vaping juices, e-liquids, also vaping products themselves, just like vapes, pods, mods. And some were selling wholesale kits. And we found the three countries that most represented these posts came from Indonesia, the United Arab Emirates, and the United States. And a lot of them would advertise their products and then provide a link to an external URL or contact information to encrypted messaging apps or just DMs to potentially lead to a sale.
Great, thanks very much, Neil. I think we're running a little bit out of time, so if someone has a quick question, go ahead and let us know. If not,
I have a quick question, Tim. Neil, could you talk a little bit more about the geographic component of your study? It's pretty interesting that Indonesia represents half the data there.
Yeah, so I mean, again, there's always a potential of just the bias of the sample set that we chose, right? But it was interesting, I think, for us too, how we found it. We haven't really dove deeper into it. But yeah, I mean, essentially what we found is it was a pretty large, global marketplace. There were people selling products from different countries. Indonesia and UAE made up the most of it. We also found a lot of posts from Indonesia that were related to established brick and mortar stores selling and advertising on Instagram too. So maybe that's just a method in Indonesia where they can advertise their product to others. That's something that we got to look deeper into, I think.
Great, sounds good. We'll go ahead and move on to the next presentation. Thank you very much, Neil. The next presentation, the title is Intention to Vaccinate During the Twindemic, Influenza and COVID-19 Vaccine Decision-Making in Adult Residents in Pima County, Arizona. Author, if you're available, go ahead and get started.
Hi, I'm Maiya Block. I'm a second-year MPH student at the College of Public Health at the University of Arizona. And our research question, which we were trying to address through focus groups, was what are the factors which affect intention to vaccinate against seasonal influenza and COVID-19 among Pima County adults? The recruitment for this focus group occurred via calls, emails, Instagram, Facebook, and other personal connections. Ultimately, the results of this focus group will inform a survey which the Pima County Health Department will administer annually to assess vaccine hesitancy for these.
Love. If Kyla did that.
Barely, I think we hear you talking, just so you know. Okay, and the findings from this qualitative analysis suggest that risk perceptions of COVID-19 are generally high and may drive higher rates of influenza vaccination, and that most participants were distrusting about future COVID-19 vaccines and prefer to wait as they did not want to vaccinate immediately.
Great, sounds very good. Any questions from participants? And I do appreciate you guys going so quickly through your presentations, and also very much encourage people to put questions in the chat. All the authors can interact with you in the chat as well. Any questions? Anyone can come in. I'm just gonna pose a question in case and no one else comes in, but did you see any interaction between what people's thoughts were or preconceived notions were around influenza vaccines and how it impacted their COVID-19 vaccine decision-making, kind of the interaction between those 2 points? I think most of the results you presented were on one or the other.
Yeah, we're still in the middle of trying to analyze what the interactions may be, but it does seem from initial findings that past vaccination behavior does affect future vaccination behavior. And so if your attitudes are generally positive towards the vaccines, that may also influence how you might perceive the COVID-19 vaccine. But there are also very unique factors that are affecting people's ideas and attitudes and beliefs surrounding COVID-19, especially considering, for example, the politicization of the issue and how it has been pushed so quickly forward, like with Operation Warp Speed. But more findings soon to come, so stay tuned. My contact is there as well if people want to know more later on.
Sounds good. I'm curious as well about the study, so thank you very much. Our next poster is Adolescents' Preferences on the Use of Social Media by Diabetes Care Teams to Support Type 1 Diabetes Management. Go ahead. We're looking forward to this presentation.
Great, thanks, Tim. My name is Faisal Malik from the University of Washington and Seattle Children's Research Institute. So my research focuses on improving health outcomes in adolescents and young adults with diabetes. So With that research mission in mind, we recently completed a study examining adolescent preferences related to social media as a tool to manage their type 1 diabetes with their diabetes care team. And the big takeaway is that they're open to it. So nearly 70% of adolescents of those who responded indicated that if given the option, they were very likely or somewhat likely to communicate with their diabetes provider on social media. This included asking urgent questions, non-urgent questions, receiving educational material, and even diabetes-specific support. So we're excited to take the quantitative findings and tie it into some of the qualitative work we did to inform the survey. And we're going to try to design an intervention where the teens with diabetes can actually talk with their care team. So we'll let you know how that goes.
Sounds good. That's really very applicable, an applicable result right now. So any questions from anyone?
I guess I wonder, how did you ask them about using patient portals as well?
Yeah, actually a lot of that we did some qualitative work around it, and they talked about how they don't really access it. There was some direct comparison. We did ask them about how social media compared to using a patient portal, and overwhelmingly they favored using social media as their desired means to communicate outside of the clinic setting.
Great. Social media meaningful use maybe in the future. We'll see. So thank you very much. Our next presentation comes from it's titled, The Mediating Role of Anxiety Symptoms in the Link Between Chronic Illness and Problematic Social Media Use in Young Adults.
Hey, I'm Anna Jolliffe. I am a research specialist at the University of Wisconsin-Madison in the lab of Dr. Megan Moreno. So as Dr. Malik mentioned right before me, social media can offer a lot to people with chronic illness as far as illness management and support. The purpose of this study was to understand whether people with chronic illness, specifically gastrointestinal and neurological illness, were more at risk of developing problematic social media use. So through an online survey of about 4,000 young adults that we recruited through Qualtrics, we found both that gastrointestinal illness and neurological illness predicted problematic social media use in young adults, and that this relationship was strongly mediated by anxiety. So in conclusion, people with chronic illness or anxiety may well benefit and do benefit from the positive affordances of social media. However, they might benefit also from education around how to identify and avoid its problematic use.
Great, sounds good. Lots of different angles you can go on this study. Any questions from anyone? Well, we got one question in the chat, so I'm going to ask that one. How did you define problematic use of social media, which I think can be very interpretive?
Yeah, so for the purpose of this study, we looked at the core features of addiction that were outlined by Griffiths in 2005. So that includes things like withdrawal, things like foregoing other responsibilities or relationships because you're engaged in social media use. So we tried not to look at, just minutes spent, but actually what are some of the psychological and kind of real world impacts of use. It was the Bergen social networking addiction scale, if anyone else cares to use it.
Great, sounds good. That's a great reference. Thank you so much. We're going to go to our next one. I think we're keeping on time, so we're just going to keep plowing through, and do appreciate all you guys are doing a great job presenting. The next one's titled Sober Badge Data, Sobriety and Alcohol Abstinence Measurement Characteristics and Considerations.
Hello, I'm Jason Colditz, a PhD candidate at the University of Pittsburgh. This is one of the sub-analyses of my current dissertation research, and I'm also a member of the Center for Behavioral Health, Media, and Technology at the University of Pittsburgh, as is Anna, who I see also, who's on the next poster. So hi, Anna, I see you out there. This poster is, our research question was essentially about the Sober Badge data points, which are metadata that are particularly alluring to look at abstinence status, which is a common outcome in alcohol use recovery research. But previous studies haven't looked at the measurement characteristics, so our goal was to understand whether or not the Sober Badge metadata were an accurate approximation of abstinence. Findings indicated that they were reasonably accurate if you looked at them dichotomously, as in more or less than 30 days abstinent. However, as a continuous indicator, there were several measurement issues, and we wouldn't recommend using them as a sole indicator of abstinence status.
Excellent. I've never thought about badging to, as a surveillance tool. Really fascinating. Any questions from anyone? Real quickly, do you think there's bias in the sample when it comes to badging and who, basically tries to get a badge?
Absolutely. Yeah, there's some issue of, fewer than half of the users have an active badge, and mobile users tend to not have active badges. So there's probably some discrepancy in terms of who's using mobile versus desktop versions of this forum. And one thing we'd like to look at in the future is whether there are differences among these users who are badge users and non-badge users. We haven't quite dug that deeply into it yet.
Yeah, that's fascinating. We're doing a lot of badging in education and doing it for substance use disorder. Very fascinating. Thank you so much. The next presentation is, I know we are all going through a similar experience right now: boredom, stress, anxiety, confusion, and fear. Qualitative analysis of adolescents' mental health blogging during COVID-19.
Hi, so I'm Sana Karim, and I'm Dr. Radovic's research assistant on SOVA, which is also through the University of Pittsburgh through UPMC. So we currently already have an existing social media intervention that is a space for adolescents who show self-reported symptoms of anxiety and depression, to give them a dedicated space to talk about their mental health in a moderate, anonymous platform. So when COVID struck, we noticed that there were a lot of posts specifically about the topic. So we're doing a qualitative analysis of the 40 posts that talked about COVID during the first 6 months, and trying to see what results are starting to appear. We had already analyzed 5 of them with our comments, and we found consistent themes that while young people are commiserating with each other about difficulties with their mental health, they're offering their own unique stories about resilience and growth, as well as offering each other with peer support.
Great. I'm sorry, I'm reading the poster.
No, you're good.
Any questions? There's so much that we could talk about in this one. Any questions from anyone, participants? So you have some really good code sections. So just real quickly, what do you think is the interaction point? Like, if you have more anxiety, you're more likely to post, or you're more likely to express certain conditions online. Did you see any trends that really stuck out at you?
Not yet. So far, we haven't really found anything about their specific mental illness diagnoses or symptoms. We have already noticed that there have been more discussions about how their depression is being affected, but thus far it's been mostly about coping mechanisms to prevent the negative effects of COVID and mentally, yeah.
Great, okay.
The one thing is we recruit people who already identify with being depressed or anxious. So we don't have people who are not.
I see. So you don't have like a control baseline, I guess. But still, these are people talking about their coping mechanisms, which they may later report on the efficacy of those coping mechanisms in their own user-generated comments, correct?
Yes.
Cool. Okay, great. Thank you so much. We'll go on to the next presentation. We have 3 left, and I've asked for like 2 minutes or so that we can go over for the next session. So we'll see if they allow that. The next one's comparison of older adults' exposure to and sharing of health-related messages on Facebook by chronic condition status.
Yes, hi everyone. My name is Carrie Miller, and I'm a postdoctoral scholar at Virginia Commonwealth University, and I work with Bernard Femler, and I had the privilege of analyzing these data that were collected by my colleagues at the University of Connecticut. So these data were collected as part of a larger online survey administered via Qualtrics, and to be included in these analyses, respondents had to be a regular Facebook user, so logging on at least once per week, and to be at least 50 years old. So our primary outcomes of interest were captured using 6 items to assess, both having seen or having posted or shared in 3 different areas. So 1, post related or containing health information, news or stories, and 2, post containing health behaviors such as exercise, smoking cessation, or getting vaccinated, and 3, posts containing about others or their own specific medical conditions. So if you want to take a quick look at table 2, our results and our and also the conclusions are that compared to those without a chronic medical condition, those with a chronic medical condition were significantly more likely to have both seen and posted or shared messages containing health information, as well as to have had seen or shared or post messages about a specific medical condition. And there were no differences in the middle there of that chart between those 2 groups about posts containing health behaviors.
Great, sounds good. Any questions from participants? And I am very sorry, we have about 4 minutes left. I just want to make sure everyone gets through. Please make comments back on the boards later on. Lots of interesting stuff there. We're going to move on to the next presentation. Apologies.
All right.
The next one is leisure term pathological internet gaming disorder and alcohol use disorder in young adults.
Hi, everyone. My name is Ajay. I'm a medical student at University of Wisconsin-Madison, work in Dr. Mayo's group as well. And so the objective of this study was to look at the prevalence and demographics of internet gaming disorder, particularly in young adults ages 18 to 25, and also to see its interaction with alcohol use disorder. So the design of the study was that we had about 4,700 participants that were categorized based on their, or subcategorized based on their alcohol use and internet gaming behaviors. And then I looked specifically at some of the demographics, age, gender, and employment status, as well as anxiety and depression scores. And kind of the major takeaways is that internet gaming disorder is associated with male gender and employment, but not with age. That IGD, or internet gaming disorder, is more associated with severe anxiety and depression. That a quarter of the participants that we analyzed were positive for internet gaming disorder, and those that were comorbid for both internet gaming disorder and alcohol use disorder had the most severe anxiety and depression scores. So that's a little bit on the project.
Yeah, sounds like a syndemic of alcohol use and internet gaming going on at the same time. Fascinating. Next presentation, I will, if we have like a few minutes, open it up to people who want to ask any questions to the last 3 presentations, and apologies you guys didn't get direct questions. The last one is using social media to recruit vulnerable populations to participate in a mobile health intervention.
Hi everyone, my name is Rosa Hernandez Ramos. I'm affiliated with UC Berkeley School of Social Welfare as well as UCSF Center for Vulnerable Population. Our main research questions was if it was possible to recruit a diverse sample using social media advertisements. Specifically, we were interested in vulnerable populations such as those with low income, lower education, low literacy, and people with limited digital skills. Preliminary results and really surface level results of disseminating a text messaging platform via Craigslist and Facebook revealed that it was possible to recruit large samples. We were able to recruit 257 participants within a 6-month period. And the major takeaway that we got from this study is that recruiting via social media is most effective when we implement user-centered design and ad creation, including, for example, using personas, which are physical characterizations of users. And when you target those characteristics within the ads themselves, you get a larger sample recruited.
Wow, I've never heard of recruitment on Craigslist. That's fascinating. Maybe I'm just not well versed in online recruiting. Thank you so much. Everyone did such a great job. I will say we need to give more time to the poster sessions moving forward, especially in this virtual format. It's a lot harder in this virtual format. Does anyone have any questions for the last 3 posters? And please, just go ahead and ask your questions directly. And as a reminder, one was about recruitment methodologies. One was about comparison of older adults when it comes to health-related messages that they're viewing when they have chronic conditions. And another one was about internet gaming and alcohol use disorder. And technically we are at time, but again, very much encourage you guys to Go on Mural, comment to people. The feedback is very important, I think, for all of us. And thanks again for the great job the presenters did. You guys did a really good job plowing through these. I hope people can stay, but we will see you in the session. Thanks, everyone. Thanks for your help, Sarah. I appreciate it.
Yeah, I'm impressed that you and the presenters were able to get through all of the posters. That was an accomplishment.
Yeah, the presenters did great. It's all because they honored the rules and they respected each other. That's really, really encouraged. They did a great job.
They did.
But we definitely need to create some more time for these guys.
I know. I miss being able to walk through a hall with posters and talk with people.
But I hope that people interact on Mural. It looks like people are. So as long as we keep that up, then hopefully they can have those interactions there.
Yeah, absolutely. And for people who are still in this room, I just reposted the link to the main Zoom room, which is where we'll have the final panel awards and closing. So that is the link to click to get back to the remaining part of the program.
See you guys there.
Thanks, everyone.
Bye.